Hi, my name is Grace Ryan. Today I'm going to teach Olivia Flynn, a first year student, how to record a pulse. So Olivia, have you ever recorded a pulse before?
No.
Okay, so today we're going to go through some of the basics. Firstly, when you're taking a pulse, you must always note the rate, the rhythm and the depth. The rate of a regular pulse is always 60 to 100 beats per minute in a normal healthy heart. The rhythm and depth are strong, easily felt and regular. Okay, you may notice in some patients they will have a faster pulse. This may be due to anxiety or nervousness. A faster pulse is also called tachycardia, and this is for beats over 100 beats per minute. You may notice patients who are critically ill or on certain medications, they might have a slower pulse. The medical term for this is bradycardia, and it's a pulse less than 60 beats per minute. So Olivia, I'm going to start off by demonstrating on myself how to take a pulse, and then I'm going to ask you to demonstrate on me, okay? Okay, so firstly Olivia, you use the first and second finger. You apply a small amount of pressure here on the radial artery. Okay, once you feel the pulse, you record it for 1 minute, noting the beats per minute and any irregularities, okay?
Yeah.
Okay, so Olivia, I'll
Okay.
get you to demonstrate please.
So I use my 2 fingers and I push it onto the radial artery and I feel it for a pulse.
Can you feel the pulse?
I can, yeah. And I count for a minute.
That's it, exactly,
Okay.
Olivia. That's perfect. And just to note any changes that you notice in the pulse, like a tachycardic pulse or a bradycardic pulse. Can you remember what those are?
Yeah.
Okay, perfect. So basically you record those in the nursing documentation notes, and you always report it to a senior member of staff or to a doctor. So Olivia, any questions?
How often should I take a pulse, patient's pulse?
Okay, so basically the main reason for taking a pulse is to set a baseline for the patient. Okay, so anything that's significantly higher or lower than the patient's original baseline value, you will always document it. You will note the changes. You will feel for irregularities. You'll note if it's tachycardic, if it's bradycardic, and you'll always report it to a senior member of staff. Other patients, such as those that are critically ill, have an infection, undergoing a blood transfusion, or post-surgery, their pulse will also be monitored more frequently to notify any irregularities. Is that okay?
Yeah.
Have you got any more questions?
No, that's great.
That's brilliant. Thanks very much, Olivia.
No problem.